serious session. So if anybody is not serious, give way to the others because we are taking only limited students. Get ready with your papers and pencils. 30 sessions. Okay. 36 into 2, 72 points. $72 rounds. Yes. So we are going to have 2 points for each question and 2 minutes for each question. So 2 minutes, everything is doubled. Okay, 2 minutes for each question as in the exam. So we have that. And yes, the question is here. You have 2 minutes exactly. 30 seconds more. Last 5 seconds. So now what I'm going to do is, yeah, very good. I'm giving you the links. Okay, copy, post link. Okay, this is the link for the post, and this is the link for the message. So you can go there, and then what you can do is A, B, C options are there. You can click on them because I'm going to explain them now. I'm going to explain them now. Click on that one, and you will know the answer there itself. And then this is question. Okay, countdown to victory. Countdown to victory. So we are counting down. So everyone will be double dosed, counted twice, because the first one is your answer and the second one is my answer. So 36 plus 36, 72 rounds. So first round is yours. You will attack and you will fire your gun, and then I will fire my machine gun. Right. So we are there here 2 rounds because it's a battle, it's a war, and we are fighting. So question number 36. So now you're going to fire your question number 36. When I tell you to submit your response after my countdown from 7 to 1, then only you have to submit. Okay. 7, 6, 5, 4, 3, 2, 1, and submit. Submit your answers. Come on, shoot. Shoot. Yes, we are in a battle. I want the live action. I want to hear the thunder. Only 5 bullets fired so far. 6, yes. There are 11 students, only half. Okay, 7, good, good. Come on, follow. 9, very good. 2 more are left. 10, red, very good. Those are inactive, please stay away, no problem. Yes, the last one, last bullet. Yes, I am the enemy for you and you are my enemy. Yes, so you have thundered 11 bullets here. Yes, that's enough. So all of you have said it is A. So let me see. Reena A, Rajalakshmi A, Binu A, then Dinny A, Carolyn A, Punita A, Harpreet and Sina and Jaya and Neetu. Every one of you have said A. Okay, now let us see how we are going to build this up. We have to know why, what's the exact way. Okay, you have found your answers, all of you. I am no greater than you because you are the soldier, but I am the commander. You are the soldier and I am the commander. I'm guiding you. I'm going to tell you the secrets how to manage this one. Okay. The extract informs us that. What does the extract inform? The extract informs us that. Okay, now let us see here. So it is information-based question. Information-based question. The extract informs us that. Information-based question. Okay, that's very clear. So, extract informs about what? Informs that what? Informs that what? What does it inform? Now let us see. Does it inform about the amount of oxytocin given depending on how the patient reacts? So the amount of oxytocin, it is talking about oxytocin. It is focusing on oxytocin. Oxytocin, according to requirement, according to the patient's reaction, depends on patient, how he reacts. The amount of oxytocin, according to the requirement. Oxytocin is the center. Patient will react to oxytocin. Okay. Amount will react to, amount depends on oxytocin. Amount of oxytocin depends. Oxytocin depends on the patient's reaction. So, the amount of oxytocin given will depend on how the patient reacts. So here, patient reacts well or not, how he reacts. Okay, the manner of reaction. So this is related to oxytocin. Number one, it is related to oxytocin. The patient will go into labor as soon as oxytocin is administered. The patient will go into labor as soon as oxytocin is given, administered. So this is talking about labor. First one is talking about the oxytocin and the second one is talking about the labor. The next one, the staff should inspect the oxytocin pump before use. The staff should inspect the oxytocin pump. So this is regarding the pump. Pump is very important here. Pump is very important here. Before using, oxytocin pump should be inspected. So inspection of pump. Inspection of what? Inspection of pump. So inspection. Pump is important here. Here labor is important. Here oxytocin is important. So try to understand. In the first one, oxytocin is important. And the second one, labor is important. And in the third one, pump is important. That's why it should be checked. Checking the pump is very important. That is what he's telling you. Checking the pump is very important. Okay, fine. Now let us see. Yes, you already got the answer whether it is right or not. But what we are going to see is this one. The amount of oxytocin given will depend on how the patient reacts. So patient reaction, based on that one, oxytocin amount is given. Okay, less the reaction. Okay, less the reaction or more the reaction. Less the amount of oxytocin or more the amount of oxytocin. Okay, fine. Right, next one. The patient will go into labor as soon as oxytocin is administered. Now try to understand this one, the reaction here. Okay, right. The staff should inspect. This is the end product, that is labor, end product. So the first one, the reaction. So something is given, patient is reacting. So this is the, not end product. This is the ingredient. You're giving something and patient is reacting. So input is oxytocin, output is reaction. Next one, patient will go into labor as soon as oxytocin is administered. Oxytocin is input, labor is the output. So try to understand what you see here. Okay, first one is oxytocin. Oxytocin. Second one is labor. Third one is pump. So this is not before using, this is talking about. So inspection. Fine. Now let us see here. Now, I'll give one chance to, yes. Here, just see very clearly, right? Very clearly. Now, the third line, okay? In the third line, he's telling here, dosage. This is very important word, dosage. What do you mean by dosage? Dosage means the amount of medication is called dosage. The amount of medication is called dosage of oxytocin is determined by the uterine response. So the uterine response, that means the patient reacts. Read between the lines. Yeah. Now try to understand. Okay. Try to understand there. Is determined by, will depend on. Okay. Right. Now you understand very clearly. All the words are very clear there. So just for this one, what is important? So here it is talking about the dosage. How do you know that it is talking about the dosage? See here. It is here itself. Oxytocin and dosage. Here itself you know. But the word is not given, so that's why you are confused. He said amount. Don't you know that amounts means dosage? It is in the heading itself. It is in the heading itself. Amount means dosage. Amount means dosage. Oxytocin is here itself. Extract from guidelines, oxytocin, and number one is oxytocin dosage and administration. Oxygen dosage and administration. Dosage is already given. Don't you relate this word dosage with amount? There itself it is there. Here itself we got the answer. It is about the dosage. Okay. And then here you can see here, dosage is straight away related to amount. And this is indirectly related to dosage is dosage and dosage to amount. So anyway you take, the answer is very clear there itself. And of oxytocin, uterine response is determined by. So it is determined by, or this oxytocin depends on the reaction. Okay. Oxytocin, the amount is determined by, okay, given will depend on. So it is talking the other way around. The meaning is one and the same. Okay. So the amount of oxytocin given. So by somebody. Right. Okay. Now that's very clear. That's very clear in the title itself. So read the title very carefully. Read the title very carefully. The title is here. Okay. The title is here and the subtitle is here. The title is here and oxytocin is the title and subtitle is dosage and administration. See here. That's very clear. So extract from guidelines of oxytocin. Oxytocin dosage and administration. Dosage. There itself it is the answer. If you understand what do you mean by dosage. Dosage means the amount, the quantity, the required, size or amount or whatever it is. That is the dosage. You have to know that one. If you know that one, you will not waste your time. You don't need 2 minutes. You just need 30 seconds. This is the easiest question coming in the end of the 36 means sixth question in the part B. So 6 questions each. There are 6 tests I'm taking now. 6 tests. Okay. So that's very clear. Hope you understood this. Right. Height floating controls. Yeah, I'm taking the picture of this. Print screen. Okay. And I'm posting it here. Sorry. Waste of energy. Here. The channel. Okay. So don't you know that the simple thing is there? Okay. Yes, there you are. That's the point. Now let me ask you one question. Did the explanation enhance your thinking styles? Did it add to your imagination? Did it add to your imagination? You know what I'm asking is, if the explanation added you nothing, then you give points 0. And if you added everything, you give points 10. And if it was 50-50, some points I knew, and 50-50 balanced. So some I learned, okay, half I knew and half I learned new. So that is 5. So what you can do is you can score the technique. You can score the technique from 0 to 10. 0 to 10. You can score the technique from 0 to 10. Come on, hit the button. I'm giving you 15 seconds. If it added value to your quality, 100%, then give 10. If did not add anything, oh, nothing new, sir, I know everything what you have told, then you give 0. Okay, hit the button. 15 seconds. 15 seconds. You all got the answer, definitely. But maybe you have struggled, I don't know. Or maybe you just easily you ate it up. That's fine. So what I wanted to see whether, okay, you have learned anything new. That's what I wanted. That's all. So clear all drawings. Yes, we are moving on. Fine. Yes, this iPhone. I don't know. I have phones also as my students. Okay, iPhone. Can you please write your name, please? Name, please. Okay. You can send me personally so that I can change, because I don't know how to communicate with phone. Suwad. Yeah, very good. Suwad. Thank you very much, Suwad. Very nice. Somebody responds to you. Very nice. I feel very happy when I come to know the person's names. Very good. Right. Thank you very much. Yeah, here we are. And the next question will go. So, are you ready for 72 rounds? 72 rounds now. I'm asking you. 72 rounds. 2 rounds are over. 2 rounds are over. So, 72 rounds. That means, so 36 rounds you are going to fire and 36 rounds I'm going to fire. Whose power is more? Let us check. You are 16, you are 15 and I am 1. You're 15 and I'm 1. Come on. Are you ready? Are you ready for the war? for the big battle. Yes, are you ready? Come on, hit the button. Yes. I need some energy. I need some powers. Have we seen you? Yes. For example, magicians and clowns and all these people need claps. Jokers, comedians, they need claps. But I don't need any claps because I know I'm doing something good. But I just need to see that you're yes. Yes. You can invite your friends. You can invite your friends if you want. Make it a big hit today. Yeah. 35. From 36, we are coming to 35. Yeah. So next question is here. You have 2 minutes to go. Do all your firing. Use machine guns, you know, whatever you want, tanks or missiles, or blow them. But don't answer anywhere until I tell you. Okay? So you can go there and you can think about this one. I'm going to copy post link. This is the post link. And then this is the message link. Okay, you'll get the answer there for question number 35. We are going countdown. Question 35. Write in your notebook also and put a tick mark. Afterwards, you will have to send it to me. Yeah. That is question number 35. 2 minutes to go. 10 seconds more. Yes. So I have given you the links. You can submit your answer there for question number 35. Now here, submit. I think you have already submitted there. Okay. 7, 6, 5, 4, 3, 2, 1. Submit. So submit your responses in the chat box. 1, 2, 3. Come on, fast, fast. Is this a battle? In battle, anybody sleeps? 6, half alive. Till 7 more. Yes, 6. What about the rest? Come on, come on. 7. No problem, we'll wait for you. 10 seconds. Yes, so only half alive. 8. Maybe we need time a little. No problem, we'll give. Nine. We are waiting for you. We're waiting for you because we feel that you are serious. We don't want to leave you or abandon you. Come on. Right, now let us see. 9 students. One more, I'm waiting, just one more. Right. So most of you have said, okay. Very good. Very good. Most of the students have written. Okay, fine. Yeah, we are there to explain you why it is. Why it is. Yes, what we are going to. We are going to explain. That is what I'm going to give you a reverse. I'm going to hit a missile. Don't worry. Don't you worry. Now the memo reminds nursing staff to avoid. So here something should be avoided. So to avoid something. To avoid something. What is that something to be avoided? Right. Then a memo reminds nursing staff to avoid. Avoid what? Avoid what? Yes, avoid what? Avoid something. Okay, avoid. What should we avoid? Okay, fine. Right, now let us see. Avoid X-raying. Okay, a patient unless pH readings exceed 5.5. Next one, the use of a particular method. Avoid the use of a particular method. A method. Avoid the use of a particular method of testing pH levels. Okay. Next one. avoid reliance on pH testing in patients taking acid inhibiting medication. Okay, acid inhibiting medication. Avoid reliance on pH testing in patients taking acid inhibiting medication. If they are taking some medication, okay, avoid reliance. So there are three things: avoid X-raying, avoid the use of a particular method of testing pH levels. Okay. Then next one, avoid reliance on pH testing in patients taking acid inhibiting medication. Okay, now try to understand here. Okay, now, so that is very clear. It's very clear. The point is blank there. Avoid X-raying, avoid the use of a particular method, or avoid reliance. Okay, now check here very carefully. Avoid X-raying, avoid the use, avoid reliance. Okay, avoid X-raying a patient unless pH readings exceed 5.5. Okay, so after 5.5, so pH 5.5 is very important here. 5.5 pH is very important here. No 5.5, no X-ray. That's the number one. No 5.5, no X-ray. Remember very carefully what I'm telling you. 5.5, yes. X-ray, yes. No 5.5, below 5.5. Okay. So no X-ray. So that's the meaning. So pH exceeds 5.5. 5.5 also no. 5.5 above, then yes. Equal to 5.5, no. Less than 5.5, no X-ray. Remember one thing there. So we read between the lines what he's telling you. So 5.5 number is there, it's very important. So equal to 5.5, less than 5.5, above 5.5. Exceed. Exceed means more than. So more than 5.5, okay. X-ray, okay. Less than 5.5, X-ray, no. So that's it. So try to understand. Avoid X-ray if it is less than or equal to 5.5. That is the point. Remember very careful. Less than also is important. Equal to also important. Because in a question, 5.5 may be there. 5.5 may be there. Okay. Now next one. The use of a particular method. A particular method means one particular method. A particular. A is very important here. One. A means number one. The use of a particular method means any one particular method. Any one particular method. That means you can take all the methods. Don't take only one method. That is what he's telling. Don't take just one. Try all the possible ways he's telling. Here you can understand some message here. The use of a particular method. So don't take any single method only. Don't rely on one particular method. That is what is the meaning. That means what all possibilities are there. Take all the possibilities. That is he's telling. So don't depend on only one particular method. So if that particular method may fail you. So you can take the other methods also, so that they may give some options. So for example, depending on a particular friend to go for a party, depending on a particular, that means only one particular friend, and he will say no, then what will you do? Your picnic is lost. So remember that. Your party, you will not go to the party. So the use of a particular transportation method to go to your office. So you think that you will go by train, or you go by bus, or you go by auto, or you go by scooter. Something wrong happens, then you will not go. So you have to not depend on one particular this thing. That is the meaning here. Try to read between the lines there. Try to read between the lines. This is the toughest question, in fact. Okay, and not the toughest, but it is tougher question. Not easy, not toughest, not the toughest. Okay, now here is telling, don't depend on any one particular method. That means try all. If you read between the lines, he is telling you indirectly, try all the possible methods. Can't you understand? So avoid the use of any one particular method of testing pH levels. That means use all the methods possible. Okay, this is a logic behind it. A is very important. A means one. A means one. Remember that. Okay, A is playing a very big role here. So don't use any one particular method. That is the meaning. Don't use, avoid the use of any one particular method because you like it or because it is possible or because it is available. Try all. Indirectly he is telling you, use, this is negative way. Positive way of telling is, okay, positive way of telling is use all the possible methods of testing pH level. That is the indirect meaning. Okay, next one. Reliance on pH testing in patients taking acid inhibiting medication. So avoid relying on pH testing in patients taking acid inhibiting medication. So what is this memo advising the nurse staff to avoid? Okay, that's reminding. What is it remind? So here pH testing, pH, all are pH only. A is pH, B is pH, C is pH. Everywhere it is pH. So the special option is reliance on pH testing in, especially in acid inhibiting medication conditions, circumstances. So try to understand that one. Okay, right. Now let us see here. Now read again based on that points which I have told you. Even you need not read the paragraph itself. It's a common sense question. Actually, you don't need anything here. You don't need anything here. It's a common sense question. Just a common sense question. It is very clear. Simple as that. Yes. Now let us see here. Here it is the answer. Here itself. The answer is here. One of the following. It is essential to confirm the position of the tube in the stomach by one of the following. Confirm the position. If the first one is not showing the position, take the second one. If second one is not taking the position, take the third one. By one, you have to confirm the position. Confirming the position by any one is important. So just don't depend on one. Take any one possible to confirm. Confirm the position. If the first one is not confirming, take the second one. If the second one is not confirming, take the first one. But confirmation as the position is very important. So take any one possible, not any one particular. Just don't depend on one. Take any one, either of them. Suwad. I think it is very clear to you now. A particular method. Yes. Now let us see a particular method. A. Yeah. There in the first one, A means the use of a particular method. Any one particular method. No. By second one is also any one. So first one is negative, avoid. But second one is positive. Take any method. But the first one is avoid any one method. That the answer is telling use any one method. It is essential. Here it is telling avoid. Here it is telling essential. See the difference. See the difference. Striking difference. Here it is telling essential. Means very important. Read between the lines. Here it is telling essential. Here it is telling avoid. So try to read between the lines. In the first one is telling avoid the use of any one particular method of testing pH levels. But in the answer, the passage or the paragraph is telling very clearly there. It is essential, not avoid. It is essential to confirm the position of the tube in the stomach by any one of the following. So if one doesn't confirm, take the other one. If the other one doesn't confirm, take the first one. I hope you understand what I'm telling you. There itself is the answer. Where are you finding? Where are you finding? Okay. The answer is there itself. In the heading, in the beginning only answer is there. That's the reason. That's the reason. Okay. Fine. I'm getting back to you. Let me take the picture of this and send it to the Telegram channel so that some other people can get a clear picture. And method means the following two methods. First one is aspirate and second one is X-rays. If aspirate is not working, use the X-rays. If X-ray is not working, use the aspirate. Take both. One of them will definitely give you. That is the meaning there. Okay. Yep. So now let's come to clear all drawings. Yeah, some comments. I don't understand why the answer is B has changed to very clear, sir. Thank you. I thank you for paying attention. Yes, now I give Suwa the chance to speak. Yes, Suwa, what did you learn from this particular point? Yes, Suwa. We can unmute. Okay, fine. Next. So you can give an explanation. Okay. What was the difference? Why could you not find earlier? Why could you not understand earlier? Okay. What is the difference? In your own words, if you can tell, the others also will be very happy. Yeah. So last option. And next. Okay. Right. Now let us see. Rajya Lakshmi. Hello, Rajam. These are my regular students. So, Punita.
Sir.
Yeah, Punita.
Good afternoon.
Was there any difference? What is the difference?
So
Did you
that,
learn anything new from this session now?
Yes, sir. That I am not read properly. That particularly A means that single. Yes. That I before I am not read properly, sir. After your explanation, I understood that.
Okay, okay, fine. So A is very important. Now you understand A means one, correct?
Yes, sir. Yes, sir.
So people don't think that A is very important. A will hit you black and blue. See here. A particular means one.
One. Yes, sir.
So this is that problem. Okay, A means one. Many people don't realize that A means one. Okay.
Yes, sir. Thank you very much, sir.
Okay, this is negative. The question is negative, but the answer is positive. That is why you got confused. You understand now?
Yes, sir. Yes, sir.
Avoid anyone, but use anyone. Okay.
Okay,
so that's
sir.
it. Okay, use anyone means either this or that, not any particular one. Use any particular one, not avoid any particular one. Use any particular one, but means use both of them. That's the meaning. Okay.
Okay, sir. Thank you, sir.
Okay, fine, fine. Now, yeah, next we are moving. Yeah. So question number 34. Question 34. So, are you ready? Yes, come on, because many people say we don't want too many questions, sir. Some questions only we need. I took already 72 rounds. Yeah. Are you ready? So I want at least 10 bullets. 10 yes. Okay. Come on, fast, fast. We are not moving ahead with sleeping people. Fast. Yes, yes, yes. You have to be dynamite. Okay. Right, very good. We have come to 10 numbers. Now we are moving to the next question. Okay, so this is 35. 35 to 34. So 34. Yes, 34. So third round of bullets. Yes, third round of bullets. Okay, fine. Here we are. 2 minutes for you. 30 seconds. Yes. So question number 34. Question 34. When I tell you to submit your response, you have to submit. 7, 6, 5, 4, 3, 2, 1, and submit. And parallelly write the answers in your notebook also. 1 to 36, write and write the answers there. Only 4. Okay, take 30 minutes more, 30 seconds more. Those who already completed, think about how the answer will be right. What are the various options? Think. Yeah. Yes, 7. Yes. So that is a B. Some have written C and some have written B, and one has written A. Okay. Now, let us check it out. So you have already got the answer from the Telegram group. So no need to go for that. So now, yes. So 7 students have given. What about the others? Yes. So, right. Fine. Now let us go with the discussion. Yeah. The group known as impatient patients, are more likely to continue with a course of prescribed medication if. So more likely to continue. So continue if. Okay. The group known as impatient patients are more likely to continue with a course of prescribed medication if. Continue medication if. So that's it. So we know that medication is already here. Okay. Continue means adherence. Okay. Impatient, patience is here. So everything is there in the title only. So if only is new. With the course of prescribed medication, if means what condition? What condition? You have to see there. So if their treatment can be completed over a reduced period of time. So period is time. Period of time. Reduced period of time. So less time. Time should be reduced, minimized. So time down. Period, less period. If it is 10 days, then it should be 2 days. If it is 10 months, then it should be 3 months, like that. Reduced period of time. If it is possible to link their treatment with a financial advantage, if there is some benefit for them financially, low cost, low budget treatment, like that. So financial benefit is there, or you give them some bonus, or you give them some incentive, something like that. Otherwise, it's a short-term benefits are explained to them. So are explained, information is passed to them, pass on information. Okay. So now see here. First one is reduced period of time is a short term, that is there here in C. Next one, financial advantage is there here in C. Now you can understand very clearly something which is explained in first point, only one is there, reduced time. In second point, only advantage is there. And these 2 points are there in C. Don't you think that there is a finer link to that side? Reduced period of time means a short term. Financial advantage means benefit. So both these things, one is short term and one is benefit, both should be informed to them. If you keep silent, what is the use? He will not understand anything. So you should try to understand. First one is reduced period of time, number one, and benefits, number two. Both they should be told, informed. Not only the term should be reduced, not only there should be benefit, but these term and benefit should be explained to them. If they are not explained, they will not listen only. So you have to inform them. Passing on information regarding the short term and regarding the benefits, both are important. Not just making it short term, not just giving them benefits, but you should inform them that you are changing it to short term and you are giving them benefits. The information regarding both should be also passed. Not only giving short term, not only giving a benefit, but the information should be passed on to them. That is very important. So the answer is very clear. It's a common sense question. Okay. It's a common sense question. Very simple it is. Actually, you don't need to read the passage also. Okay. You don't need to read the passage also. That's very clear. If on what condition? Advantage or a time? Time or benefit? Both time and benefit. And that should be important. Not only giving time less, not only giving advantage, but the information. Without telling the person who is receiving those, what is the use of giving them? You give a chocolate to somebody and you are not telling that I will give you a chocolate, then how will the response be? Response will not be there. You want to give a chocolate to your daughter. You want to give a chocolate to your son or a brother or a sister or whatever it is. And you keep it in your mind. And I will give my sister a chocolate if she does the homework. But you don't give. How will she know and how will she complete? Keep the chocolate in front there. And don't even directly tell them, I will give a chocolate to somebody if they give homework, if they do the homework. Oh, immediately they will run and do the homework. So that is called motive. You have to pass on the information. Motive behind it is not just reducing the time, not just giving financial benefit, but make them known to the patient there. If the patient doesn't know that there is advantage, why he will do? If the patient doesn't know that you are giving short-term treatment, how will he know? Knowledge is more important than just doing action. Make them known is more important. This is just a common sense question here. You can understand that very clearly. Okay. So next one, if you want still to see in the passage, definitely you can see in the passage. Now let us see here. Right. So first one, in the first sentence, I'll show you the answer. In the middle sentences, I'll show you the answer. In the ending sentences, I'll show. What, sir? For first only, we are not able to, one answer only, we are not able to find. How can you show in 3 places, sir? Yes, that is the technique. Answer is everywhere for every question. Only the thing is you have to identify that one. Almost all the questions, the answers are scattered everywhere because it is unique. The pattern is unique. Right. Now let us see there. Now I will show you. I will cut it into parts now. Yeah. So a recent article addressed the behavior of people who have a taste for the present rather than the future. So now here itself answer is there. Here itself answer is there in the first line. Don't you understand that? Can you identify the answer in the first line itself? If you are a scholar, you can definitely understand. If you are an excellent, outstanding student, you can definitely understand. Okay, that is the secret. Knowledge, variety is the spice of life. So here is the answer. A recent article addressed the behavior of the people who have a taste for the present, not the future. Present instead of the present means a short term, future means long term. Don't you understand the difference? Behavior of the people, behave of the people who have a taste for the present rather than the future. Taste for, they have a taste for the future, not for the taste for the present instead of the future, rather than, but not for the future. So that means they are present oriented people, means they want less time. They don't want long term, short term, only reduced period of time. They want in present only everything. They don't want to postpone till future. Okay, today only everything should be solved, or this week only, or this month only, this year only everything should be solved. This, present, this year, present, this month, present, this week, present, this day, present. So present means what? This. Future, next year, next month, next week, tomorrow. That is future. You understand what? Present and past don't vary according to something. It vary according to your mind. If you talk today, today is present, tomorrow is future, yesterday is past. If you say this year is present, next year will be future, last year will be past. That's all. Tense is that it. So time is divided like that. Present means now, means this year. How can you say this year as present? Then you are mad if you don't understand the concept. So here, taste for the present. Why they have taste for the present? Because they are benefited. Advantage is there itself. People behave differently if they get something they want. They have the taste, means they are getting the taste, means they want something and they are getting. So they are happy. That means they are getting benefited. Don't you understand that? In every line, answer is there. A person who is going to get A grade will get the answer here itself. A person who is going to get B grade will get the answer in the next sentence. So I'll show you in the next sentence now. One place only we cannot find, sir. How can you find answers in everywhere? Okay. That is it. You have to know. Yeah. It proposed that these so-called impatient patients are unlikely to adhere to medications. This is the ulta or the reverse of the previous sentence. If you come, I will give you. If you don't come, I will not give you. What nonsense it is. Simple, simply superb. Simply superb. This is the reverse statement. It proposed that these so-called impatient patients, impatient means they don't have patience for a long time. The impatient, patience only is the word. In one word only the meaning is there. Impatient patient means they are not patient patients. They are not patient patients. That means they are not ready to stay for long time. They want immediate. So immediate patients. Impatient means not ready to wait for long time. They're not patient enough to spend much time. So that is in the word, two words, impatient, patience. Patients who are not ready to spend much time. Their only answer is there. That means less time they want. They don't want to prolong. Okay, right. So that require use over an extended. Here he said present, and here he's telling extended period. See here, don't you understand extended period? Extended period means not present to the future. Are unlikely to other. Unlikely means not stick. Unlikely means do not want to adhere, means continue. So it is there in the second line. Don't you see that it is there in the second line? A postgraduate student can understand from the second line. He'll get B+. And in the next line also answer will be there. The article proposes that an impatient genotype exists and that addresses these patients' view of the future while stressing the immediate advantage. Can't you see the answer here? He stresses means gives importance. The immediate advantages. Don't you see the immediate means a short term, advantages means benefits. Don't you see the answer everywhere? The third line also answer is there. Okay, now let us see. Okay, sir, you told every line answer will be there. So let me see, sir. I want to see another one. Will it be there in another sentence? I don't know, but let us check. I'm also explaining this example for the first time. The authors suggest that rather than attempting to change the character of those who are impatient, it may be wise to ascertain the patient's individual priorities, particularly as they relate to immediate, means a short term, gains, means advance. Is it not there? It is there. I'm telling you, I'm seeing this one the first time. I'm explaining this one for the first time. You see my history of channel, nowhere it is explained before. So it is here. In the fourth line, it is there. So that means top one is A grade, second one is B+, third one is B, third one is C+. That means a person who is getting this answer in the sixth line, he will get C+. Then another line, let us see. Next sentence. Will we get the answer here? You understand the concept, you can find the answer anywhere. You don't understand the concept, you cannot find the answer anywhere. That is the difference. So for example, while advising an impatient patient with diabetes, stressing improvement in visual acuity rather than avoidance of retinopathy may result in greater medication adherence rate. Now try to understand here. Here you are going to a depth of scientific subject. Visual acuity. So stressing the improvement in visual acuity. For example, while advising an impatient patient with diabetes, stressing improvement in visual acuity rather than avoidance of reading may result in greater medication. So visual acuity means what you see. Okay, what you see. And avoidance of retinopathy may result in greater medication adherence. Greater means more. Adherence rates. If you focus in visual acuity, stressing improvement in visual acuity. What do you mean by visual acuity? So let us see here. Acuity, A-C-U-I-T-Y. Okay, 1 second. We have to go to our Cambridge Dictionary once again. This question will blast your brains because the answer is evident everywhere, but still we face difficulty because we don't understand the concept. That is the point. Okay, Cambridge Dictionary. See, whenever I have a problem, I'll go to Cambridge Dictionary. So acuity. Yeah, acuity. So it is formal word, very special word. The ability to hear, see, or think accurately and clearly. So now try to understand here. The ability to hear, see, or think accurately and clearly. So this is, and then next one is, the question here you see there. Yeah. Now, if you see there, visual acuity. So the person is not able to see properly, not able to hear properly, not able to understand properly. So focusing on this one is more important. Stressing. So stressing on improvement in visual acuity means vision, hearing, and understanding. If you improve on this one, rather than avoidance of retinopathy. So you tell no need retinopathy. Okay. Avoidance of retinopathy. What is meant by retinopathy? You know well. I need not explain that. So avoidance of retinopathy. So now avoiding retinopathy, if you say avoid retinopathy, he will not be interested. Okay. Because it is a long procedure. Right. So now if eyes are clear, visual. Okay. Retinopathy is there something. Okay. Let us go to that point and get a clarity for that one also. Retinopathy. So retinopathy means that a disease of the retina. Retinopathy means a disease of the retina. The area of the back of the eye that is sensitive to light. The area at the back of the eye that is sensitive to light. So avoiding this disease. Okay, avoiding this disease or making improve the eyesight and vision. So if the vision is, if you are avoiding the treatment for this one, okay, right? And then if you are going to give him, give stress on improving vision and hearing and sense, then automatically the medication adherence rates increase, greater they will be. Result means benefit. So greater benefits will be there. So that's what he's telling here also. This is short term and that is long term. Okay. Avoiding this disease. Avoiding this disease or improving visual acuity. So you see both of them. So then he will stick on to which one more? The first one. Then additionally linking the cost of frequently changing prescription lenses when visual acuity fluctuates with glycemic levels may sometimes provide the patient with an immediate financial motivation for improving adherence. See here. So here also he's telling you immediate means a short term, financial, both are there, not just financial, not just financial. Second one is just financial. First one only short term. First one only short term. Second one only financial. Third one financial plus. Here it is very clear, but only a +2 student or a school student will get the answer here, but it's not very clear there. Patient with an immediate financial gain. Now let us see here. So the last option is here. Immediate means a short term. Financial means advantage. So linking means connecting and informing him. Now let us relate here. How many places the answer is there? Reduced period of time. This is time means a short term. Okay. I'll change the color to black. Okay. Thin line. Okay. Reduced period of time means a short term. Financial benefit means advantage means benefits. So now these two things are everywhere. You see, present benefits a taste. Taste means like, means advantage. He's getting it. Who have a taste, he has a taste for that and he's getting it. That's why his behavior is different. Next one. Let us see the second one. Extended. An extended period of time. Short term became extended period of time. So benefit, unlikely to adhere. Okay. Right. Impatient patients are unlikely to adhere, that requires use over an extended period of time. You can see here short term, extended time. Unlikely means not interested. Okay. So he's not benefited. That's why he's unlikely. Unlikely to adhere. So because there is no benefit, he will not stick on. No benefit, long term, no benefit. Short term, yes benefit, long term, no benefit. That is what, unlikely, negative word will be there. Okay. Next one, third one, short term, immediate. Benefit means advantages. And fourth line, immediate. Benefits means gains. Words will be changed. Next one, short term means visual acuity. Long term is avoidance of retinopathy. Okay. Greater medication adherence, that is benefit. Next one, greater, more, benefit. Then next one, immediate means a short term. Financial motivation means benefit. That's it. I don't know whether you follow me or not, I don't know, but that is the fact of the matter. That is the fact of the matter. You should know these things. Okay. I told you this will blow off your brains. Okay, because many questions it will be like this, but I don't see, instead of explaining this one question, I can explain 10 questions. But if you know the technique, no, you can find answer everywhere. If you learn that one, it is easy for you to gain more knowledge. Okay, 3 bullets down. 3 plus 3, 6. So, how was that missile? What score will you give from 0 to 10 for this missile? Score, please. Just take 10 seconds time and give your score so that I want to know whether you understood or not. The importance of learning, not the importance of finding the answer. Yes, please. Fast, we don't have all the time in the world. Okay. Even if you give 0 also, no problem, but just give it fast. Okay. So that means people did not understand what we were discussing, or they are just switched on the phone and they are doing some other work. Active people are very less. I don't know. I lose motivation to teach also sometimes because of this. Okay. So just message something now, what you gained or something like that, so that we can move forward. Okay. These questions I ask only to check whether some people are active or not. So let me see how many active people are there. Okay. Instead of sleeping people. So let me read out the active people. So the others are sleeping. Let us think like that. Smita. Smita is active. That means she is ready now. She's listening very carefully. Neelam. Okay, she's ready. She's listening. Punita is attending. Reena is attending the session. Dinny is attending the session. Carolyn is attending the session. Rehana Shafi is attending the session. So there are the other people who are just sleeping. Okay, no problem. Let us not mind them. We'll go ahead. We will go ahead. So 34 over. 34 over. Now we are moving to 33. Yes. Question number 33. Question number 33. Come on. So 2 minutes. So here it is. I'll give you the links also. Question number 33. This is the 4th bullet. question 033. Okay, this is the link, copy post link, and this is the message link from the group. First one is better, so join the group. First one is better. So join the first one, not in the second one. Join the first one. It is better because it is the group. Second one is the group. First one is the channel. Channel is more active. Yes, 2 minutes. Yes. So time up. So now we are going to submit the response. So submit. This is very simple question. Dead easy question actually. 7, 6, 5, 4, 3, 2, 1. Submit. Dead easy question. 8, 10. Very good. That's it. So people are activated now. Okay. 11. Very good. Excellent. So now let us see. This is a very easy question. Okay. Now, so 13 students have given. Very good. Now let us see. The purpose. The purpose. The purpose of these instructions. Instructions inform something. To explain. Explain means inform. How to. How to means method. How to means method. The instructions are there to explain the method. What method of what? Method to monitor or to position. To position means to place. To handle means manage. Monitor means observation. Write down the synonyms. Monitor means only synonyms. Nothing is there. Nothing is there. Monitor means observe, supervise, look, watch. Monitor, observe, look, supervise, watch. So these are the words. Position. Position means place, arrange, manage, set, fix. Position. Electrodes. Fix electrodes. Set electrodes. Manage electrodes. Okay, fix electrodes. Handle an animal. Handle means manage. Okay, sorry. Now here, yeah, handle. Handle means manage. Okay, operate, work. Okay, work out. So these are the meanings. Now if you see the heading, CT 200 CV Veterinarian Electrocardiograph User Manual. The title says Animal Connection. What is this connection? Try to understand. Connection means connect. There itself answer is there. Okay, there itself answer is there. If you don't understand the answer, see in the next line. Good electrode connection is the most important factor. Good electrode connection is the good electrode connection is the most important factor. Good electrode connection is the most important factor. Okay, now there itself answers are there very clearly. Answers are very clear there. So let us see. Good, correctly, connection, position, electrode, electrodes. Okay. Everywhere answer is there. Place, attach means position. Wait. If you can understand, I will not explain all the questions like this. Not, I cannot. If I explain too much time, it will be. So now here, good means correct. If it is correct, then only it is good. Connection means position. Okay, electrode, electrode. Okay, now fine. That's okay. Next one is, okay, clean. So these are the steps to position. Okay, place, pinch, check. Check the connection. Okay, check the LCD's display. Okay. So if there is no hard reading, have a contact problem. You have a contact problem. Contact means again positioning problem with one or more of the leads. Okay. So contact means connection. Contacting means connection. Okay. So reapply the clips means reconnect, recheck and reconnect. Reposition, recheck means reposition. Reapply means reconnect. Okay. Reconnect the clips means reposition. See, everywhere the answer is there. Check. Check whether the position is proper or not. Okay. Then pinch a skin and then only you can position, check the position properly. And place clips, position. Place means position. Your placing means positioning. Placing, positioning, word will relate. Okay. Place means again position. Place means again position. I think I have to take a thinner lines. So this is the last question I'm explaining so depth. Okay. So let us see here. Okay. Now again, good means correct. Electrodes, connection, position. And next one. Okay. By following a few basic steps, consistent clean recordings can be achieved. Shave a patch of each forelimb of the state. Contact. Contact means position. Contact means connect. Connect means position. Position site. Contact site means position site. Okay. Clean the electrode sites. Okay. Right. Next one. Attach clips. Attaching clips means positioning. Okay. So ECG leads electrodes. The next one, place a small amount of ECG electrode gel on the metal electrode. Adapter, clip, place means position, connection, contact. So pin skin of the animal and place again here. Okay, and then the animal must be kept still. Check of the position. Okay, for display, for constant heart. If there is no heart trending, we have a contact problem. Contact means position is wrong. Okay, with one or more leads means electrodes. The next one, recheck the position. Reapply the clips means position. So everywhere the answer is there. Everywhere the answer is there. Check whether it is correct or not. You do recheck and reapply it. You recheck whether it is correct or not. If it is not correct, you make it correct. Reapply the clips correctly. So put the positions correct. Everywhere the answer is there. Okay. Everywhere the answer is there. So what is the answer? Most of you have written. Yeah, most of you have written B. Okay, answer is everywhere. Fine. Only the thing is you have to read between the lines. Yes, we have done 4 questions so far. Let me post this in the Telegram channel. Print a screen. చిన్న కొద్దిగా టీ పెట్టిస్తావు నేను పెట్టుకుంటా లేకపోతే బిజీగా ఉంటే నేను పెట్టుకుంటా ఓకే సో I hope you understood the point. Okay. What is this? Yeah. So the techniques are facts. 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 F is for focus. A is for attention. C is for concentration. People don't have concentration. What to do? Okay. Then next one is T is for techniques. Why I will tell you these things every time. S is for strategies. So facts. Remember the word facts. It is an acronym. I have created it for you so that you remember these 5 things which are very, very important. So 4 over. Okay. Now, my question. Yeah. Is the explanation okay useful to you? Say yes or no. If you say no, then benefit for me. I can reduce my time. Why to waste my time? Correct, no? Yes. 7 students are very active now. Rajalakshmi, Reena, Robin, Binu, and Neelam, Punita, and Carolyn. So these are the active students. Okay, very fine. Yes, Rehana. Okay, now the next question is, are you ready for the next shot? Are you ready for the next shot? Come on, fast. If you say 10 people say yes, then I'm going ahead with another one. Otherwise, I'll go and have a break. So, how many are there? Oh, very good, very good. Too fast, very good. So that is, you're interested, so I'll become interested. Very good. So now we'll move on to the next one. So that is 32. 32. Yes, this is the question number 32. Yeah. Question 032. Question 032. Fine. Question number 32. This is the link, copy post link where you can check your answer whether it is right or not. Okay. And this is the message link. First one, prefer first one. Prefer the first one rather than the second one. That means instead of the second one, prefer the first one. So here it is. 2 minutes for you. 30 seconds more. Yes. So having done that, now we are moving further. Yes. You have already checked your answer, I suppose. But whatever you have written, your original answer, same answer, you can type here. No problem. Nobody is pointing out you. Nobody is bothered about you. Okay, only you and I. You are bothered about your progress. I am bothered about your progress. So let me know who is getting, so that I can help more. If everyone is correcting the answer and writing, I will not know who is writing what correct answer. So better be clear, so that I will afterwards go through them and I'll see. So who is needs more support, I'll give individual attention to them. That is the reason why. Okay. If you write the fact 7, 6, 5, 4, 3, 2, 1 and submit. So yeah, Jaya Ajo. Jaya Ajo has written A. All others have written B. This means Jaya Ajo needs more of my support. Right. That's why. Okay. Why I am asking you to write the fact. If you lost your mark or something like that, no problem at all. Jaya Ajo. I appreciate. Hello, Jaya.
Hello, sir.
Hello, Jaya.
Hello, sir.
Yeah. Do you understand the importance of why I am telling you to write the answer as it is? Lineo
Yeah.
Boklaho from Lesotho. Yeah, Jaya, you understand what I am telling you?
Yes, sir.
Because you need more of my support. Because you are facing a problem in this particular question. So now I know why I'm asking you to write. Already you know the answer. Why I'm asking you to write, so that I will ask you only. Okay, those who are writing mistakes, then I'll ask, is that clear? Or you will tell it is clear or like that. So you are more important for this question, because all others got the correct answer. Maybe no problem. No problem
Yes,
at all.
sir.
And Lineo
Yes,
Boklo.
sir.
Yeah. So no worries. We are least bothered about anybody else. We are bothered about you and me. That's all. I'm bothered about you and you are bothered about you. That's all. So don't worry. Okay. So fine. I'm muting you back. So now we have the explanation here. We are going for the explanation here. We are going for the explanation here. Okay. So the guidelines inform us. Inform means tell. Every time remember this one. That personalized equipment for radiotherapy. Personalized equipment. Personalized. Individualized. That means depends on person, place and time. So depends on person. Personalized equipment means depends on person. Personalized equipment means, so it is advisable for all patients. It is advisable for all patients. Personalized equipment is advisable for all patients. All. Personalized for all. So personalized equipment for radiotherapy is advisable for all patients. All patients. All. Remember that. All is very important here. Personalized and all. So that means everyone should have personalized. That is the meaning here. Improves precision. Advisable for all. Means for everyone it is needed. Everyone. All. Next one. Improves precision during radiation. Improves precision. So precision means perfection. Okay, personalized equipment improves precision means perfection. That means next one, needs to be tested at the first consultation. Tested. Personalized equipment needs to be tested at the first consultation itself. So it is all patients are perfection or testing. Patients are perfection or testing. Patients are perfection or testing. Advisable to use for all patients means patients are important here. So all patients. So patients important. Improves precision during radiation. Precision means perfection. Precise means correct, clear, perfect. So you should know the meaning of the word precision. Precise means very clear, perfect. Okay. Needs to be tested. at the first consultation, testing. So is it regarding the patients, or is it regarding perfection, or is it regarding testing? So that you have to see here. Guidelines, radiation simulation planning appointment. Okay. Now see it very clearly. Okay. See this one very clearly. So based on these points, go through the question. You'll read between the lines now. Yeah. Now, let us see here. Personalized equipment for radiotherapy, all patients, precision testing. So now, see very carefully here, one point. So this is talking about the initial appointment is here. First consultant, the initial appointment. The initial appointment means the first consultation, that's it. May also be referred to as a simulation appointment. Simulation appointment. Okay, forget that. Nothing else is there. Initial appointment, that's all. Simulation appointment. During this appointment, you will discuss your patient's medical history and treatment options and agree on a radiotherapy treatment plan. So that's it. Only this one is there. The first step is usually to take a CT scan of the area requiring treatment. Okay. Right. The patient will meet the radiation oncologist, their registrar, and radiation therapists. A decision will be made regarding the best and most comfortable position for treatment, and this will be replicated daily for the duration of the treatment. Depending on the area of the body to be treated, personalized. Where is personalized equipment? See there. Here it is coming. So why do we want to read everything? We have to go only here because the question is here only. So personalized equipment starts from here. It is first time appearing here. Personalized equipment. Okay. Personalized equipment. Fine. Personalized equipment. Fine. That's fine. So for there you can understand if a person whose head is very fat, his face is huge, then same mask is used for a thin person and a fat person. Okay, huge face and a tiny face. Can you use the same mask? If you want to hold his position. So try to understand that one. What type of mask is needed? It should not be loose. It should be perfect. So try to understand that one. There it is. There it is. Why? If you use a fat or a huge face mask for a tiny face, it will not be perfect. It cannot control everything perfectly. Okay. Right? So try to understand here what he's telling. Okay. Then next is, let us see here. After that only you will get, depending on the area of the body to be treated, personalized equipment such as a face mask may be used to stabilize the patient's position. So where treatment, face means face mask, leg means some other protection or something like that. Okay, now let us see. This equipment helps to keep the patient comfortable and still during the treatment and makes the treatment more accurate. Already answer is there before only, but still here it is there. More accurate. Accurate is the word which means precision. More means improves. Makes more means improve. Answer is everywhere. Answer is everywhere. You can see everywhere answer. I'm not going to explain everything every time. You can find everywhere. Okay. Is there in the beginning? Is there in the end? Is there in the middle? Okay. Now let us see here. if you want to go exactly to the spot, go to the word personalized equipment there. This equipment helps to keep the patient comfortable and still during the treatment, and makes more means improves. Makes more means improves. Accurate means precise, perfect. You should know the meaning of the word. You should know the meaning of the word. Okay? That's the name of the game. Okay? So now see here. Here also, a decision will be made regarding the best and most comfortable position for treatment. Best means what? Best means what? Excellent. Excellent means what? Accurate. Accurate means what? Good. See, answer is everywhere. Only the thing is you have to read between the lines. So the best position means precise position. Okay. Most comfortable. Most means positive, improves, increases. Right. And let us take here. During this appointment, you will discuss your patient's medical history and treatment options and agree on a radiotherapy treatment plan. The first step is usually to take a CT scan of the requiring treatment. The patient will meet the radiation oncologist, their registrar and radiation therapist. Why? To make it everything. Why? The initial, here itself answer is there. Initial appointment is not for perfection. That means the final stage is different. It's going to be perfect. The initial appointment is not bringing perfection. The initial, the medial, and the final. So the last stage will give improvement. There only the first word itself. Initial appointment is just the basics. This is not give you perfection. Initially, you will not get perfection. That is what he's telling. So slowly, perfection is improved. From the beginning, slowly how this story is developed. So during this appointment, you will discuss, okay, what you will do, how you will do, how to improve the quality and all. So initially, nothing will be there, but finally, everything will be there. So that means gradually, from the initial appointment to the final appointment, there is improvement. From the initial to the final use of this equipment, there is improvement. Okay. So there is improvement. And this improvement is to make everything perfect. Everything perfect. Okay. Why planning? Planning because you want something perfect. Okay. Planning to bring precision. Here itself answer is there. You plan. See, for example, I want to build a house. You plan. That means you need precise things. I want the bedroom here. I want the kitchen here. I want the washroom here. I want the entry here. I want the back door here. Everything planning in precision, perfection. If you do not plan, you will not be perfect. People do not plan. They directly go to the exam and they fail and come. Why? No precision, no perfection, no planning. They'll say, I'll book the exam and I'll go for the exam. Is that wise enough? Is the decision wise? That's not wise. So first prepare, make yourself perfect, plan something, then afterwards prepare. And once you are ready, then you book for the exam. That is the way how you have to do. Okay. There are some students. I don't want to name the students, but if I tell them they are excellent students, outstanding students, okay, you may feel, oh, sir, we did not discuss with you our exam date. That's why you're telling like this. No, I'm least bothered about when you are going for the exam or when you are booking the exam. I'm least bothered. But when you give me importance, I'll tell you the best possible option. Okay. I have nothing to do. Whether you go for 2 months or 3 months or 4 months, the fees is the same thing I'm taking. Okay. So until you go for the exam, I'm taking the same fee. So no problem for me. Okay. So in fact, if you go for the exam and come back, I'll get more gain. So I said, go 1 month, you go and finish the exam, fail and come again. I'll get more money. Not like that. Okay. So it's not like that. So what I'm telling you is there are 2 or 3 students who told, sir, when you tell me to book the exam that time, I'm really proud of those students. I'm really proud of those students. Okay. The children who say, Mama, you tell me, because you are the best judge, whom I have to marry, whom I have to, okay, what I have to do, okay, what job I have to go for, suggest me. Okay, decision I will take, but you suggest me. Suggestions I need. So then suggestion, your decision is yours. Suggestions is your mother's or father's. Suggestions they'll tell you for your own good. Okay, right? There are some papas and mamas who trouble children also. No, you should do like this one. That is wrong. Okay, suggestions they have to give. So in the same way, I'm giving you suggestions. So they are following me 100%. Sir, when you tell me to go for the exam, then only I'll go. I'm really proud of them. Okay, maybe they are in the group also now. Okay, fine. Right, high floating meetings. So you have to learn all these things first. Okay, learn all these things first. When you go for the exam, first time only you have to clear and come. That's all. Okay, you have to clear it in the first step. Print a screen. Okay. Now the word simulation, I'll show you another meaning. Simulation. What do you mean by simulation? If you know the meanings of these words, it is very wonderful. Now I'm going to give you the meaning of this word simulation. Simulation. Do you know the meaning of this word? You'll get a clear picture of what it is. Simulation means a model of the set of problems or events that can be used to teach someone how to do something, or the process of making such a model. That means this is the experiment. Simulation means starting experiment, testing. Initial testing to prove whether the real, see, for example, if you want to build a mega bridge, you will build a small bridge first. You'll build a test pilot project. We say pilot project. Simulation is nothing but a pilot project. So if you know the meaning of that one, you need not go till the last also. So simulation referred to as simulation apartments, to think and plan. Plan for what? You plan for perfection. You plan for perfection. Why do you plan? You plan so that everything will be perfect. You plan so that everything will be perfect. You plan so that everything will be perfect. Perfection. Accurate. Precision. The meanings of that. Simulation is a pilot project. Pilot project means initial testing zone, whether the final product will be fine or not. Test. Why you are testing? To check whether you are perfect or not. Why OET exam? To check whether you are perfect in English or not. Your English is precise or not. Your knowledge is accurate or not. Testing project. You are going to the real life situation in a hospital, and you are going to work with real patients, and you have damaged or broken English, and you are playing with the life of a patient. Are you perfect or not? This is a simulation only for the reality. Try to understand what I'm telling you. Okay. So this test proves that you are perfect. Okay, by learning and preparing for this, you are improving your precision. You are becoming more accurate. You are becoming more and more perfect in English. I'm adapting this to your learning. So that's what it is. Okay. Clear all drawings. Yeah. Vipanasha, I motivate. I don't motivate. I motivate myself. I'm sorry. Right. If I motivate myself, no? Direct message. Okay, fine. Okay. Right. Thank you very much for the comment. I liked it. But yeah, I need your motivation. Okay. If you say, all of you say yes. Okay. I'll be motivated. More energy will come. More than a cup of black coffee or decoction, we say. Okay. More than that, I get energy. Okay. Okay. Your one yes is a powerful machine gun bullet, loaded, fully energetic for me. Okay. I don't need any drug. So you agree with me? Yeah. You agree with me? Your yes is a big drug for me. Yes. If you understand, I don't need anything. If you say, I understand, sir, that means if you don't understand, if nobody says yes, what I am teaching rubbish. That's why they don't understand. They don't even say yes. So that is what I think. So that what makes me, I feel low and I don't feel like, explaining, because what I'm explaining is not useful. I think that is the another way. So fine. Next one, the next point we are going. So we are going with the sixth question now, sixth bullet. So totally 36 bullets, 2 rounds. One you are firing and one I am firing. Both of us will fire the OET itself. We'll fire the OET exam itself. They should know that we are doing something great on this platform, lovely platform. Okay, all right. So we are going. So to the next question. So this completes one session. So one complete test is B, part B. One complete part B. Have we selected the right ones? So 31, yeah, 31, forward. Yeah. Yes, this is 31. This is the sixth bullet, first round. So 6 rounds we are going to fire. 6 are 36. 6 are 36. You fire 6 rounds and I am firing 6 rounds. So total 12 rounds into 6 questions. That means total 6 tests part B we are learning. 6 tests part B we are learning. So first test is going to be finished with this question. This is question number 31. We are counting down till we come to 0. Okay. So question 031. So 6 questions, 31 to 36 we finished. This is the official book. Okay, that is official nursing book. I'll show you where you can get official book. Okay, this is official book, nursing official book. Okay, practice book for medicine is here. Okay, this is book for medicine. And from this third test is that one now, what we are doing. My son has prepared these slides. So that's why I'm able to do all these things now. Okay. So this is the official book. Okay, from this last test we are doing now. So last test is something around 200. No, not 200. Yeah, somewhere around 200. Okay. Let us see there. So this is, yeah. Yes, here you are. These are the questions now which we are doing. So this extract informs us that oxytocin, you can see here. Oxytocin we have done. Staff to avoid what we have done. Impatient patients we have done. Instructions, monitoring instructions, we have done this. Then guidelines, radiotherapy, this is just now we have done. Okay, guidelines, simulation, planning upon, just now we have done. And now we are going to do the last of this set. The policy document tells us that. So that is for doctors and this is for nurses. Medicine and nurses. Okay, this is for nursing. Yeah, this is for nursing. So from this book, nurses you can take from this book. Okay, this is medic official OET practice book. I only take authentic books. I don't take all rubbish books which are there. Prepared by the OET. Them only I will take. Anybody can write book, but whether it is trustworthy, that is authenticity. Authenticity means trustworthiness. So that you have to think about. So classical corrections. Okay, fine. Yes. So question number 31. Your time starts now. 2 minutes. 30 seconds more. Yes. So we have come back, and then we are going to, yes. Now, so question number 31. So you might have checked the answers. Submit your response. 7, 6, 5, 4, 3, 2, 1, and submit. So 15 students are there. So at least 10, 11 I need. That's fine. 10 students at least are alive. Okay, live students. Very good. Some more are waking up. Very good. Okay. Thanks for your participation. Thanks for your participation. It depends on you. Whether I'll fire 6 rounds or only 1 round, I don't know. It depends on you. You people, if you're active, then I'm going to fire all the rounds. Okay, and we are going to win the battle. Okay, no more problem. No more problem with B, part B reading. Like that we will do today. So we'll see the end of this demon, part B reading. End of this demon. We'll kill it. And we'll celebrate Deepavali. The light festival, festival of lights. Okay, the demon of reading, part B. Okay, the biggest devil is coming after that, part C. Okay, every day we'll do one or the other. Right. So now let us go to the explanation part, and here we are. Okay, now the policy document tells us that, tells means informs, highlights, explains, analyzes, describes, portrays, whatever it is. That is it. The policy document tells us that, tells information, tells us that it is providing information. It is providing information regarding what? So now let us see here. I'm going to show you a different one. Are you ready to learn? Ring out the old and ring in the new. That means learn new things. Okay. So now I'm going to ask you one question. I'm going to teach you something new, which you might not have noticed a number of times. Are you interested to learn something Novel. Okay. Are you ready to learn something novel? Say yes or no. 10 seconds only. 10 seconds because I don't have time. Okay. 10 seconds. Yes. Yeah. 1. Robin Matthew, Neelam, Carolyn, Bipana, Rehana, Rajalakshmi, Binu, Juliet, Dini, Reena. So all of you, Reena, Vinish, write the names of all these people and send it to me because I'm going to give them these people who said yes, a special session. Don't send message personally to me. Otherwise, you will not be noticed, Bipana. Okay. Say yes in the open so that they will see somebody is writing the names. Okay. So I'm going to give a personal session for these people. That personal session is personal speaking session with the feedback online. Yes, Reena, will you help me? Reena, Vinish. Reena, Vinish. Yes, Peter. Anything is okay. Fine. Yes, sir. Reena Vinish is saying yes, sir. Okay, fine. Right. So all these names you send them to me because I'm going to conduct a speaking session individually for all these people before they go to sleep today. Yeah. One special session. I'll set the time and discuss everything with them. Right. Then here we are. Yeah. Now I'm showing you something which is very important. The topic of the point is commonality. Commonality. Maybe you might not have heard about it earlier. The point, the question of commonality. So let me put it here. Let me put it here. And the point is commonality. Commonality. Yeah. Okay. Okay. That's fine. And I have to put it in which color? White or black is better. Okay. That sounds fine. Yeah. So commonality. Now what is this? I should have taken some other color, yellow. Okay, fine. Right. Okay. So commonality. What do you mean by this commonality? Commonality means things which are common. For example, let us say people. People are number of people on the stage, but your eyes will be glued on the main actor. So common or ignored. Common things are ignored. Special things are being attracted to. Special things are attractions. Common things are neglected. So neglect common things. Neglect common things. Neglect common things. 3 times I told you. That means 3 times it is there. Remove that. That is the least important thing. Now, you may think that it is the most important thing, but it is the least important thing. I'm showing it out with red color. With red color. Stop dates. Stop dates. It is here. A stop date. It is here. The stop date is here. Now you try to understand what I'm telling you. So this is not important anymore. I'm not teaching you what is the right answer. I'm not teaching you how is the right answer. I'm not teaching all nonsense. I'm teaching that one which nobody will notice. Something very important because you are very important for me. You are very important for me. That is why I'm giving you these most important lectures. Stop dates. Okay. Stop dates. Stop dates. 3 times repeated is a nonsense for us now. Not any more important. Okay. Not any more important. Right. Next one. Okay. One second, please. So check like that. Anything common there? Yes. Sorry. Now here, so what are common things? Eliminate. Next one, the second common things are called prepositions. 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 What are prepositions? In is a preposition. Remove. Okay. Then for is a preposition. Remove. Okay, these are common things. Will found everywhere. They are not special. They are not very special. In, of. So how do we come to know? Select the keyword. There will be many keys in a bunch to unlock the lock. I'm telling you something very important, and it is not ridiculous. Okay, it is believable. To unlock a lock, there are many keys, but only one key will, in a key bunch, there will be many keys. Okay, related to many locks. So but every time you will have the key bunch with you, but not all the locks. Every stage you will use one lock and you will use one key. So there are a number of keys, but one is called operation. When you put the key into the keyhole and twist it, it works. Only for one, for the others, it repels, rejects. So try to understand. That is called the operating word. You don't know what is the keyword, then how do you know that? You don't have the key bunch only. Okay. Then how do you know for the operating word, the right, appropriate, or the correct, or the exact, or the accurate, or the perfect key? Okay. So how to eliminate the nonsense things? Try to understand. Commonality is nonsense. Remove all those things. The next one, verbs, helping verbs are not important. Aren't. Aren't. Okay. Aren't. Helping verb. Aren't. Helping verb. Okay. Then next one, can. Modal verb. Next, the. Article. The is an article. Must is a modal verb. Okay. Be is a helping verb. Should is a modal verb. I'm eliminating all the other things. Want is a relative pronoun. What is a relative pronoun? Like he. What means it. What means it. It means a pronoun. It's a relative pronoun. Okay. You have to know that one. Right. Anyone. Anyone. Okay. Now coming to the points. Now we are finding out the keywords. Now we are finding. So we have eliminated the unnecessary things. Now we are going to find out the important things. Right. Now, all. And here anyone. Okay. Anyone. And here prescribers. These are keywords. All means everyone. Every circumstance, situation. Okay. Right. Next one. Relevant. So it is relevant. Relevant means useful, important. Relevant means useful, important. Okay, relevant means useful and important, and circumstances. So it is talking about the relevance. So stop dates, relevance, and circumstances. Stop dates, relevance, circumstances. So stop dates is common, relevant and circumstances. So relevance is the key word here, means usefulness, necessity, need, requirement, need and requirement, compulsion. Okay, usefulness. So right, next one. Anyone using EPMA can disregard the request for a stop date. Disregard means reject. Disregard. Even if it is important, you neglect it, you disregard it, means oppose it, defend it, obstruct it, hinder it, stop it. Okay. So disregard the request for a stop date. Next one. Prescribers must know in advance. Must know in advance. Advanced knowledge. So advanced knowledge. Right. Now let us see the points here. That's so simple as that. So relevance, that means importance. Disregard means reject, power to reject. Okay. Relevance means importance in all circumstances. Disregard, relevance means must. Disregard means not must. Advance means knowledge. So first one, is it compulsory? That means relevant. It is not compulsory, that means you can reject. See the relation there. Relevant or not relevant? Not relevant, so I am disregarding. If it is relevant, how can I disregard? If it is important, how can I disregard? How can I reject? See, they are opposing. Okay. Anyone can disregard. Anyone can reject. How can anyone reject? Then what is the use of that date? Stop date. Okay. Prescribers must know in advance of prescribing what the stop date should be. How do we know when we should stop? Until we know that everything is perfect. So advanced knowledge. First one is usefulness. Second one is, first one is imposing. Second one is opposing. And third one is having knowledge. Imposing means make it a rule if it is compulsory. Okay. Is it compulsory or not? Second one is can reject if it is not necessary. Third one is we should know in advance what stop date should be. So that is it. Now let us see. Prescribing stop dates. Prescribing stop dates. So you are prescribing stop dates. You are telling when to stop. If it is to be continued afterwards, you can continue. But at least you have to tell something. No, till then you continue. And later we will see whether we have to continue or not. Okay, when we have to stop. So continue till that. For example, you will give for 15 days. You prescribe medication for 15 days. If it is successful, you will stop it. If it still need to be continued, you will still continue or reduce the dosage or increase the dosage or change the medication. That is it. Stop that one. When? Deadline. That is called deadline. Stop date means a deadline. So prescriber should write a review date or a stop date. Review date means that is stop date. When to stop. That day they will review. They'll stop and review. Okay. Then next one. Right. Now let us see. So, all, anyone, and prescribers. So, now see these three things and relate the sign. Here you are going to learn a secret now, which I am going to say. Okay. Here I am going to show you a secret. Just relate these three words. Relevance means must, compulsory. Okay. That means, is it compulsory in all the circumstances? Everywhere stop date must be there. Like that, number one. Or if a stop date is there, if anybody can disregard, number two. Or everyone must know in advance, advanced knowledge of the stop date. Yes. Sometimes they don't know, then what they should do? Sometimes they don't know, then what they should do? That is the third thing. So first one is definite. Third one The first one is definitely positive, that is compulsory. So aren't relevant means negative. So can disregard means positive. Okay, because it is not necessary in all. Okay, then third one, in advanced knowledge, you should know. These three words, relevance, disregard, and advanced knowledge. These three things relate, and just read between the lines. Read between the lines there. Using these three words only, try to identify something new. If you're not able to identify, I'm going to explain you. No problem regarding that. And you can write any comments there if you want in the chat box now. You're free to write because this is knowledge gaining thing. Share your knowledge. I'll show you all the three things in the three different locations. This is the last question for this round. So I'm going to give a highlight point which you can understand. Yes, any comments? One comment is there. Okay, so leaving. Okay, fine, leaving comment. So now here, this is the point. Yes, now let us see here. I'm taking red. These are the points. Stop dates aren't relevant in all circumstances. Relevant, disregard, advance. Relevant means compulsory or not. So stop date should be prescribed 100% or not. Now let us see the condition. Are they compulsory or not? If, then is the condition. I'm teaching you this rule there. All. Should we give certificates to all the students? No, not all the students. Only to those students who got more than C plus. That means B and B plus and A grade. Only those students can get employment. Those students can go to UK. Not everyone. Why? That's the difference. Will everyone go to UK? No. Only those who get at least B will go to UK. So that means if the condition I am telling you now, compulsory or not, sometimes it is compulsory, sometimes it is not. Not everyone can go. Can everyone go to UK? The same question. Is the statement relevant? Yes. How far it is relevant? If they succeed in getting B grade in all the four, then they can go to UK, the UK. Then they can go to UK. If they do not get, they cannot go to UK. So in the same way, stop dates can be given, prescribed, if they know when to stop. If they do not know, then, so where is the word if? Where is the word if? There is the root. If is here. If is somewhere here. Yeah, here. If is the here. If is here. So in any one of these ifs you'll get. If then, definitely then will be there. Should know the rule of this one. Then is there. Wherever if is there, then is there. You see that. See that. It doesn't mean everywhere if then will be there. In this condition, it will be there. If this is satisfied, then this is the result, like that. If the prescriber knows how long the course of intravenous injections should be, then I stop. If he knows then a stop date can be filled. If he does not know, yeah, which is right. So that means that stop dates are relevant in some circumstances. If they know when the stop date, how long the course of IV should be, how long the course of, if they know, then they can give. If they do not know, don't give. They're not relevant. They're not relevant. Then how can you give? You don't know how it becomes relevant. So it is not relevant in some conditions. So it is not for all conditions. If the prescriber knows how long the course of it, then the stop date can be filled in because it is relevant, because they know it. They don't know, then what? They see the next then. Okay. If not known, here there is another then. Sorry, 3 ifs are there. I'm sorry, I missed one. And then 3 thens will be there. You got it, I think. If the prescriber knows how long the course of IV should be, then the stop date can be filled in. Otherwise, it can be left blank. Okay. That is the meaning of the first one. That means not all circumstances it is needed. Not all, only some. Knowing condition, knowing the length of the duration, knowing the duration of IV, then you can give. Otherwise, no stop date, you cannot write. That's the meaning there. Next one, if not known, this is the contrary statement to the previous one. If they do not know, first one, if they know, what you should do. If they do not know, what should, this is the opposite. That is also told. If you cannot understand yes, then you try to understand no. If not known, then a review should be added to the additional information. Example, review after 48 years. If you do not know stop date, so you will not say stop. You'll say after 48 hours review, means check and find again when to stop. Right. If the prescriber decides treatment needs to continue beyond the stop date or course length indicated, then it is their responsibility to amend the chart. So 3 ifs are there, 3 thens are there. Do you understand this if then condition? If you say the question, if it is compulsory or not, if it is compulsory or not, if it is relevant or not, if it is relevant or not. That is what OET is asking you. If it is relevant information, write in the OET letter. If it is irrelevant information, then don't write. What do you mean by relevant information? Use the relevant information. That means the same thing I'm telling you. If the candidate knows that the information is relevant, then he can fill the relevant information. One side. The other side of it, if the candidate does not know that it is irrelevant information, okay, then he can think about it. And if he decides the third point, whether it is relevant or not, it is his responsibility whether he can use it or not. That's the point. Everything is here. So what do you mean by relevance? Means important. If it is important, then use it. If it is not important, leave it. If you don't know, if you know that it is relevant, use it. If you do not know whether it is relevant or not, ask somebody. Okay, that's the point. The next one, you see here, if you know that it is irrelevant, leave it. Finished. If you know that it is relevant, use it. If you don't know that it is irrelevant, leave it. If you don't know whether it is relevant or irrelevant, ask somebody who knows it, knows about it. 3 points. The same thing it is there. So every question will have this style of argument. Relevant or not. Relevant in all circumstances or relevant in only some circumstances. That is it. When you say all, automatically it will be some. No, not all, some. That's the meaning. So here, the statement, you see, not all. Not all. Okay. So then it is some. Some means stop dates aren't relevant in all circumstances. That means stop dates are relevant in some circumstances only. He gave a reverse answer there. So try to identify the answer. He gave in a different angle. Okay. So now I am giving you the links. How many times he has shown you, I'm going to show you now. Okay. Now relevant. Relevant means it should be. Okay. Can be. Okay. Stop date. Okay. Stop date. So try to understand this one. Okay. Next one. If known, then fill. If unknown, then leave it. That's the meaning. If known, can be filled it. If known. So that's it. Not all are known. Okay. Then if not known, some are not known. Some stop dates aren't known. So then a review should be added. If stop date is known, then give the stop date. If it is not known, add a review. That's the point there. Okay. Then if the prescriber decides treatment needs to be continued beyond the stop date or course length indicated, then it is their responsibility to amend it. So stop date is not compulsory in all. So stop dates aren't relevant in some. Okay. Stop dates are relevant in some. Stop dates aren't relevant in some. But stop dates aren't relevant in all circumstances. Stop dates are relevant in only some circumstances. That is it. Okay. Here it is showing some. Here it is showing. So that's the point. So if unknown is unknown circumstances, if known, some circumstances, known circumstances, unknown circumstances, not known. Not known means unknown circumstances. If it is known circumstances, write them. If unknown circumstances, write a review. If still you have a confusion, take your responsibility. That's the point. 3 conditions. So simple as that. And remember, this is if then condition. If then condition. Write down somewhere. If then condition. If you know, there are many questions will be depending on like this. All or some. Previously, we have seen A. A is very important. Here, all means 100%. A means only one. So like that. So the answer is pointing to A. Stop dates aren't relevant in all circumstances because if then, if known or unknown, it depends on known or unknown. It depends on. Previously also, A also depends on. Remember that. Depends on. Question. The question. Right. Yeah, answer is everywhere. Who is that one who has written this? I got from the last line. Yeah, answer is everywhere. So let me check who is that. Answer I got from the last line. Robin Matthew. Yeah, you're right. You're absolutely right. It has been agreed that the routine use of review stop. Everywhere, answer is everywhere. Okay. Right. Here also there is not a forced stop date on EPMA. Here also it is there. Right. So here is the point. Yes, you are absolutely right, Robin Matthew. You're absolutely right. That is, let me show that point. Robin Matthew's point, how he got the answer. So it has been agreed that the routine use of review or stop dates using a stop date on the chart is not always appropriate. Not always means only sometimes. All means, yes, I'm giving you the point with a big line now. Okay. So let me take black only. Yeah. Always means, sorry. Always means all circumstances. Always means all circumstances. Next, not is here. Okay. Stop dates. Stop dates is here. Yeah, there also answer is there. Answer is everywhere. Answer is everywhere. Okay. Yes. So let me take the screenshot of this. So we have completed 6 rounds. First round successfully. First round of 6 questions successfully we have completed. So before closing, write your one sentence feedback. One sentence feedback. One sentence feedback. Okay, what did you learn today? Yeah, last line is a school student, Neelam. So last line will be very simple. Okay, but it will be cloudy, not very, it will be little closer, not always, but the, yeah. So in this beginning also it is there, you can see here. Prescriber should write a review date or a stop date on the electronic prescribing system, EPMA, or the medicine chart for each antimicrobial agent prescribed. That's very clear. So they should write. On the EPMA, there is a forced entry for stop dates or oral antimicrobials. That is one part. So for some, there is not a forced date on EPMA for IV antimicrobial treatment. See this. This is not. So there itself answer is there. Okay, even before if then also, but the right answer will be in the center almost always. Here also there is a forced entry, there is not a forced entry. There is not a forced stop date, there is a forced stop. For some there is, for some there is not. Here itself answer is there, here also answer is there. So you can see here, there is a forced entry. There is not a forced entry. So you can see here, there is not. So in simple terms is, okay, 1 minute. Okay. Where is this? Yeah, see here. This is there is. There is not. Everything else is common. So is and is not. There is for some and there is not for some. There itself answer is there. So you are reading and going till the last line means how much time you are wasting. That means you are wasting the time for the next question also. That's the point. Only the people who read the question will go till the last. Okay. So I'm telling you once again, the level of knowledge. A grade students will get the answer here itself. B plus will get the answer here in these 2 lines, 3 lines. And B grade students will get here. And C plus will get here answer in these 2 lines. And C students will get the answer here. And like that one. So try to understand. So automatically when you are going from here to here, that means you are wasting a lot of time, and automatically the results grades will go down because you are using time.
It actually looks like Brahmanandam's dialogue, if you guys remember.
Okay. So how much time you are wasting reading from here to here? Okay. So focus where you have to. Right. So now the first round is done. Write down some feedback, one sentence. You're closing the session in 3 minutes. And we'll bring out the second round later. I'll inform you well in advance. So be in touch with the Telegram channel, because there only I'll give everything. Yes. Select all. Yes, I'm leaving only 1 minute to finally write your feedback. There ends our session. So that's the end of the session. So yes, we are closing.